PSA from your favorite nurse. So today we're going to talk about a very serious topic: intimate partner abuse. Intimate partner abuse does not just affect women, it actually affects men as well. In a given year's time, there has been reports of over 2 million injuries that have occurred to women and over 600,000 injuries that have occurred to men. Intimate partner abuse may occur as physical abuse, sexual abuse, psychological abuse, emotional abuse, coercive abuse. Women who experience intimate partner abuse have much higher healthcare costs than non-abused women, because every time there's an injury, whether it's minor or major, and they have to go to the emergency room or to their doctor's office, that costs money. One of the most vulnerable times for a woman to experience abuse is during pregnancy. 4 to 8% of pregnant women have been abused at least once during their pregnancy. Women who have unintended pregnancies have higher prevalence of abuse. Abuse does not just happen with male-female combinations. It can be a male to female, female to female, male to male. Most women in violent or abusive relationships, they do leave. It may take longer, but a lot of them do leave. Divorce rates are higher with women who have domestic or intimate partner abuse. As a healthcare provider, you may encounter patients or patients' families who have been abused. It's really important to always assess the situation. Oftentimes, because the abuser does not want the abusee to have any independence, they may accompany them to their doctor's appointments. Sometimes the partners appear to be overly protective. They speak for their partner. And of course, they do not want their partner to be left alone with the provider. If you suspect that your patient is being abused, it's really important to try to get that patient alone with you. Whether it's, oh, I need to take this patient to x-ray, or let me help this patient use the bathroom. Do you mind stepping out for a moment? Healthcare providers are in a unique position. We're advocates for our patients. We want our patients to have the best possible care and the best possible outcomes. Now, we cannot control all situations by any means, but you can help by offering information to your client that may help them get out of their current situation. It is important for us as healthcare providers and as patient advocates to not judge. You know, my mother often said to me, you have to meet people where they stand. Your responsibility is to try to give any resource that you can to somebody that you may suspect is being abused. Our duty as advanced practice registered nurses, and I emphasize the registered nurse, because we are supposed to be advocates for our patients, our clients. We are supposed to give them the best possible care to help have good outcomes. There's tons of resources all over the place. You can definitely give printouts, websites. There's tons of phone numbers that will help a patient in a crisis situation. And of course, if there are any veterans, female veterans, there's a whole division devoted towards helping female veterans get out of their abusive situation or get counseling. Thank you for listening. And you never know, you may help save a life. Until next time, it is your favorite nurse with a public service announcement. Thank you very much for your attention.